Hey there, welcome. Sam Visnick here, Release Muscle Therapy, and in this video I want to cover the release muscle therapy process for dealing with knee issues. Now, knee issues are very common and there are many potential sources for knee issues. Now, of course, outside of general impact injuries, ACL tears, and so forth with sports, there can be chronic knee issues that can seemingly appear out of nowhere. And most of these knee issues are based on, number one, genetic factors, but two, they're compounded or made worse by movement-based imbalances. Now, if you've watched any of my videos in the past, you'll know that I'm somebody who talks very frequently about the need to assess the entire structure of the body regardless of where you're having a problem. Okay? If you have knee issues, then we all know absolutely in this field anyway that it can be related to the mechanics and the movement of the foot and the ankle. It's also sandwiched between the ankle and the hip is supposed to have a lot of movement in there. Lots of studies that talk about timing and the contribution of the glutes and the hip position to what's going on with the knee and knee torque. So there's a lot of stuff in there that might need to be evaluated. And of course, a lot of tissues. It's pretty common for people when they have knee issues to beat on the outside muscles of the thigh, doing foam rolling and so forth. And that oftentimes can help with knee issues, but it's only one muscle out of a whole chain of muscles. So we don't go after individual muscles and just kind of hammer on them with massage work. What we do is get a grasp of what is going on with mechanics. Every time your foot hits the ground, there's a whole lot of transfer of forces that go up the biomechanical chain, and our bodies have to react and to know where we are in relationship to the ground and how all of those other parts have to respond. And that is going to have big chain consequences going all the way up the body. So what we're going to do in the release muscle therapy process is to perform an evaluation, see what's going on as that foot hits the ground. Are all of the muscles doing what they're supposed to be doing? Are the joints in the positions that they need to be in for optimal force transference? And if they're not, which odds are likely they're not if you're dealing with ongoing knee issues, we're going to address that. We're going to look at where those joints need to be. We're going to position them there, train them there with exercises and movements that are going to encourage normal and optimal function. And we're going to use soft tissue release techniques, neuromuscular therapy, myofascial release, and others to address the muscles that are overworking, that are compensators, and that are maybe pulling you into positions that are not ideal biomechanically. So the release muscle therapy process is very thorough and investigative when it comes to dealing with underlying movement imbalances associated with knee problems. So I hope that you'll reach out to us if you're interested in this process to find out what's going on with your knee underlying and to address it with the most efficient processes available today. Thanks for watching.